first started working in Camden at the Cathedral Kitchen, which is one of the soup kitchens we have in the city. And through that experience found that there was a calling beyond description of words for working in Camden. It's a rich city, and we get a lot of bad press, but when you work here and you see the people here, you realize that this city is full of genuinely true, caring people, and we need to care for them because this is our community. And that's one of the reasons that I chose to come to Project Hope, because as a nurse, I can not only give back now what I was giving back at the Cathedral Kitchen, but also assist them with their medical needs as well. So that's why I chose to work at Project Hope.
I grew up in a community where some people's only access to health care were through the public health centers, and I've actually been a health center patient myself at some time in the past. I've had the opportunity to practice medicine in a number of different settings, and I actually find it most enjoyable to practice in a setting where patients have challenges with their access to care and have barriers to finding quality care.
And then I had an interview, and I really didn't know too much about what Project Hope did, but it wasn't until I actually came in and got a chance to see that, you know, we really work with the underserved population. And I've been here 4 years, and there's no other place that I would rather be. It's given me a chance to see different things that I've read about during nursing school that I probably wouldn't have seen, but I've seen a lot since I've come
here. The challenges, of course, are when we send somebody home with medications. Are they going to be able to take them? Are they going to have water to take? If we send somebody home that has wound care done, are they going to have the proper facilities to be able to care for the wound? Are they going to have soap and water? So the basics that most people would take for granted, we have to make sure that our patients have those things available for them. So that is one of the hurdles working here has brought to light.
Again, just the same thing. The challenge is the barriers to getting certain tests done, being able to refer patients to certain specialists that they need, being able to get medications that you need to treat certain disease processes.
Our patients, not only do they respond in a positive manner, sometimes their response is one of shock, like they've never heard this kind of thing before. And it's just striking that the education that I've taken for granted for so many years, to see what can happen when that education is absent.
It's a wonderful experience. It certainly is. And if you want an experience that not only gives you a patient interaction, but really a true, genuine life experience. This is really something that you would want to do in your career. And I like to think of it as we treat our patients as we would treat any of our friends or family members that are walking in the door, and that we treat them all with the inherent worth and dignity that we would want to be treated with. As far as a clinical perspective, it's such a broad scope of diagnosis that we see coming through the door, in addition to the mental health issues and the general life issues that most of us face on a daily basis. Not only is it a matter of how am I going to pay for that medication, but how am I going to get the cup of water to take the medication. So it's an experience beyond what you're going to get in a textbook and what you're going to get in a regular clinic. So I would encourage everybody to at least come in and experience some part of working in a clinic like Project Hope.
With the changes in the economy and with the way healthcare reform is going and the way that healthcare is delivered in the country now, there are a number of new patients visiting health centers every day, and there's really a growing need for doctors who are willing to provide quality care to everyone.
Nursing for me, during clinicals in school, you learn from a hospital background, from a nursing home perspective. Coming out, working in a community health center is totally different because you never know what you're going to experience. And as far as outreach is concerned, you never know what you're going to encounter. You may encounter someone in crisis. You may encounter someone who has substance abuse issues, who may have an urgent need, or someone just to talk to. And as a nurse, you have to be able to put all of that into perspective, and working at Project Hope definitely enhanced my nursing skills. Critical thinking, assessments, everything is totally different working in a community health center. We had a patient who was diagnosed with terminal cancer, and the only thing he was concerned about at the time was he had custody of his 8-year-old granddaughter, and it was around holiday time, and he just wanted a Thanksgiving basket. He said, you know, can you get me a turkey? I just want to make sure she has a nice Thanksgiving. And you know, we were in a program called Sharing Care with Our Lady of Lourdes Hospital, and that's a program in which we select families. The company selected two families where we wanted to give a Thanksgiving basket to. So I chose this particular family, and he was going through chemo. He was going through a lot of treatments. He was sick a lot, but he came in as often as he could. And we went to his home. It was delivered to his home. He got that. And then Christmas came, and again, we had to select a family that we wanted to give a nice Christmas to. And we chose this particular family once again to receive these gifts. And he came in here after the Christmas gifts were delivered, and he cried. He said, I just want to say thank you to you, because my granddaughter is going to have a Christmas, and now, you know, even though I'm diagnosed with this terminal cancer, I know that she's going to be okay. And shortly thereafter, he died. But it was that moment that I realized that's why, I realized that that's why Project Hope is here. Because we give people, no matter where they come from, the opportunity to still be treated as human beings, to still have dignity, to be treated with respect, regardless of their ability, you know, to pay, to have insurance, to have a place to lay their heads. And that's what Project Hope to me is about, not just providing medical care, but the other things that they need as well.